let's start with the fundamental basics of the lymphatic system. So it's actually part of two primary systems in your body. One is the immune system. I think it's the most important part of your immune system anyway, because its job is to scan things that come into your body through what they call lymph nodes. They're basically little mini scanners. I call them little mini toilets because their job is to find stuff, scan it, read it, tell your immune system what something is so it knows what to send out to get rid of it. It's like the sewage system in your house that flushes you out so you don't die and you can live longer. So it's really important. And if it becomes dysfunctional, you're going to feel it in some way, shape, or form, most likely through inflammation somewhere. So it's a huge part of your immune system. So in my world, if you've got an immune system problem, you got a lymphatic system problem, zero discussion. It just depends on how much of a role it's playing. Now, the other one that they don't really pay much attention to, but I think is actually even equally important, is it's part of your circulatory system, your vascular system. So that's blood flow. And that's big because if you don't get blood flow to cells, you're not living long. The reason that they tie together is that the lymphatic system dumps its end product into the veins of the body, the venous system of the body. It's roughly the same material. It just changes names of what it is depending on where you find it. Either it's in the lymphatic system or the veins. So the veins and the lymph always work together. And what's interesting, when you look at embryology, the lymphatic system grew from the venous system. So in my world, it means this. If you have a lymphatic system issue, you will have a circulation issue. If you have a circulation issue, you will have a lymphatic system issue. Now, lots of people have been talking about vascular, but they've been overlooking the lymphatics in relationship to them. That's the supply chain that your cells need in order to get nutrients to it and get the waste out after the cells use the nutrients. It's the waste management system of your body, and it's also a huge player in circulation. You're supposed to get inflammation because that's how you destroy things and you heal and recover. So it's also a repair system at the same time. But if you're stuck with all this metabolic waste, cellular waste, toxic waste inside of the body, then your body just says, well, guess what, guys? Keep killing. And then you stay inflamed until you can help that move out of you. Now, this is when people ask me, why does it get overloaded? Why does it get stagnated? So my tongue-in-cheek answer is this, but I'm really not kidding. It's called LIFE. It's the price you pay from living on this planet through stress and anxiety and toxins that are coming at you from so many different ways, emotional trauma, physical trauma, nutrition or lack thereof. It just all adds up. And then the toilets or the lymph nodes get clogged like in your house and they don't flush, and then you get disease or dis-ease. The only way you're going to get that stuff out of you is two primary ways the lymphatic system moves it so it can stay healthy. One is through movement. So the more you move of yourself, more often, more ways, more environments, more places, well, then you use muscles. And the muscles actually pump the lymph, and then the muscles actually pump the veins of the body as well. Problem is, humans don't move a lot, right? Especially over the last couple of years, we're very sedentary. So we don't move. And then when we do move, we usually move the same way. And that causes problems too, because then you have certain patterns of movement where your body lays down lines of tension and stress. And then that changes how fluid moves, kind of like how fluid moves down a mountain stream around blocks and rivers. It goes one way because it's just the way it's always gone. So people that do the same movement all the time end up with problems too. So that's why you got to vary it up. And the other way that it's supposed to move is through breathing. But not just any breathing. It's called diaphragmatic breathing. It's a muscle in your body that sits at the bottom of the rib cage here above your organs. And basically when you engage that muscle through breathing, it increases pressure in your body and it decreases pressure in your body. That increase and decrease is a pump. And it pumps not just the lymphatic fluid, but the fluids throughout the body. But that's the pump. So if you don't know about diaphragmatic breathing and you're not moving, I just shut down your toilet system. And it's going to stay inside of you, and then you're going to get inflammation. Sometimes the blockages are deep in the body, and I mean that literally, because we'll get over the different layers of the lymphatics in a moment, from the skin all the way down to your spine, breathing and moving are no longer enough to unblock it. You have to get in there and manually do it by hand. Just like I got to go in there sometimes, and when your toilet's clogged, you can flush it all you want, but it's usually going to overflow. You got to snake it or you got to plunge it. And then it knows exactly where to go. And that's what lymphatic manual massage type work is all about. Unclogging your toilets. I mentioned the toilet system in your house, which is the big one that people can understand. But I found when you're trying to explain something that's new to someone or can seem complicated or convoluted, analogies work really well to tie it to something they're already familiar with. And I do that through an example of a fish tank. My program is called Body Aquarium, because if you think about an aquarium, your body is mostly fluid. It's mostly water, like a lot. Not to mention that dehydration is one of the biggest things that is going to crush your lymphatic system, and most people are dehydrated. The lymphatic system is 90% water. Wrap your brain around that one. So if you're dehydrated, it already dried up your stream. Your cells live in a fluid environment. It's called interstitial fluid. That just means fluid between the cells. It's like a fish living in a fish tank. The fish would be your cells, but you got a couple of trillion fish inside your body. Now, if you look inside a fish tank, usually you'll see a little filter up in the corner with bubbles coming out of it. Underneath the fish tank that you can't see, you've got all these little pipes and filters and stuff like that. And then those are the things that keep the water circulating. It takes out all the fish poop, because the fish poop all day long, just like your cells do. You put food inside the tank to feed the fish. You've got the food contents in there, and then the waste from that. And then the filter gives that stuff out, and the one in the corner gives you oxygen. Now, if your filter system works great, the water looks crystal clear, the fish are thriving, and they look great. They have an awesome time. Now, what happens if that filter system, something goes wrong with it? You don't notice it right away. Usually it takes you a couple of days or a couple of weeks. Then all of a sudden, what does the water start to look like? It's very murky. It actually starts to turn green, and you see funky things growing on the glass. And then all of a sudden, you soon see stuff grow on the fish scales, like dis-ease. But if you've ever looked closely into the tank, have you ever seen a fish struggling to breathe in water that doesn't have a lot of oxygen in it? It's like this. It's doing the best it can with what it's got, but it's slowly dying. Well, that's the same thing that happens to your cells, man, because if cells don't get oxygen, you're not living long. And when you don't get oxygen, something somewhere is going to hurt. You will have pain somewhere. So this is where I ask people, how would you go about fixing that tank? Would you just take out the water, take out the fish, clean the tank, put new water in there, and then everything's great? No, you wouldn't do that, because what's going to come back? The same thing. But that's what we do in healthcare and in medicine. We clean the tank and blame the fish. And I'm like, why don't you just look at the filter system? If you go in there and then you clean the filters, unclog the filters, make sure they function well, then you put the stuff back in there. So what's the moral of this story? It's this. In my world, lymphatic work always comes first, because I got to make sure your tank works. Because here's also the dirty little secret. Everything that you're chasing to try to get better in your body lives in the tank. The filter system is the one that determines whether all the other stuff you're trying to do actually works. You cannot get well in the same environment you became ill with it. That means your external environment, but also your internal environment that you're living. Now, here's what's fascinating. Extracellular fluid is basically what I just told you about the fish tank. Viscosity is the thickness of the fluid, like engine oil. You got really thick oil or you got thinner oil. Enhances cell migration and cancer dissemination. That means that when you have a lymphatic system or a fish tank system that doesn't work well, you are going to get increased viscosity around the cells of the body because the stuff can't get out. It's got to stay there. And then you're going to get thick blood, viscous blood, aka dirty blood, because it goes into the venous system. It increases your rate of cancer spreading throughout the body. You've got about 15 liters of lymph, 5 liters of blood. So what does that tell you in the order of what the body thinks might be important? Lymph. It's located in strategic places. I told you about the joints of your body, but there's a lot of lymph at the skin, and you have a ton of lymph. Most of the lymph is in your gut and your abdomen, and it sits there because most of your immune system, the current stat is 70 to 80% of your immune system lives in your gut. If you have a gut problem, you will have a lymph problem. If you have a lymph problem, you will have a gut problem, right? And everybody has a gut problem. Gut and lung go together. Lung and gut go together. They all go together. If they don't work well, the skin carries the load, and then you bleed the toxins through your skin, and the next thing you know, why have I always got acne on my face? When you get the excess waste in the brain, you get the brain fog, you get what's called neuroinflammation, but you also have what's called the neuroimmune response, which means your nervous system and your immune system always work together, which means your brain can be a hot mess because your immune system is a hot mess. The most important first step in changing your lymphatic system is the awareness that you have one and that you should, because you can't control something until you become aware of it. And then what can you do? One, you can start moving more of yourself. How about you just walk? That's a really awesome, because that's a pump. Another one is you can just jump up and down in place or on rebounders. You were born with rebounders, they're called calves. And the calves are important. That's called your second heart in Eastern medicine, because that pumps the vein flow and the lymph flow back to your heart. So if you have stagnation in your calves, you're gonna be in big trouble. That's the first sign of a lot of dis-ease in the body, is swelling in the feet, ankles, and behind the knees, which is one of the things that you see in a lot of people. So those are all great, just jumping up and down. Breathing in and out through your nose will move that as well. So here's a novel idea. How about you jump up and down and breathe in and out through your nose? Dry brushing can be helpful, but dry brushing is going to be more for your superficial lymph near your skin, which is awesome. But here's something I want people to keep in mind. When you work the lymphatic system, you can, but you shouldn't just arbitrarily start rubbing anywhere you want to influence the lymph, because everything moves lymph, but you need to have an organization to it and a system to it of where to rub first, second, third, fourth, fifth, and sixth based on one thing: pressure. It's really critical that I explain this. When you start to study fluid dynamics, called hydrodynamics, there's a law in fluid dynamics. High pressure of fluid always goes towards low pressure. The easiest way you can envision that is a water dam that's been built where all the water is on one side and no water on the other side. When you open up the doors on the dam, the water automatically goes where? All to the low side, because that's easy. You remember where I told you the lowest pressure in the body is for lymph and veins? The subclavian vein sits right by the subclavian artery, which is the big flow pipe to the blood flow to your brain. So if that's the lowest pressure, where do you think the highest pressure would live? The furthest distance away. The feet, the hands, and what about above your brain? If you get clogged at the collarbone, the hands pay the price, the brain pays the price, and the feet. What that means is this: everything in your foot wants to get to the neck. Everything in your hand wants to get to the neck. Now, the majority of the lymph in your body goes to the left side of your neck. About 75% of the lymph goes to the left side of your neck, 25% goes to the right. Just remember this: everything down in your abdomen and your legs goes to the left side. Now, it's trying to get up there, but to get there, it's got a long way to go. It has to clear all those clusters that we mentioned before. It's got to go past the knee. It's got to go past the groin. It's got to go past your abdomen. It's got to go up your spine. Then it's got to go to your neck. Whew, that's a long way to go. So what that means in my world is this, is that when you know that high pressure goes towards low pressure, you don't start brushing in your feet, which most people do. You don't start brushing your hands, which most people do. And they brush towards the collarbone, which is great, which is where it's want to go. But I'm going to ask you this: what if you're blocked at your collarbone? What if you're blocked in your abdomen? You're sending stuff that's low to blocks higher up, and it's just going to ricochet right back down. That's an easy problem to solve. It's this: you always work from the collarbone up to the top of your head, and you always work from the collarbone down to your feet. After you do that, then you can brush the hands and the feet and stroke towards your collarbone all day long. But you have to start from the collarbone. So we teach a technique that's called the Big Six method. I isolated the biggest lymph node clusters in the body that have the most blocks, to have you unclog those first. Because if I unclog those first, guess what? All of the smaller ones, the furthest away, can now go past the blocks. Before you do the big six, I need to make sure that you are well hydrated and you have some water in your system before you do this. I usually tell people just massage above and below the collarbone on your own, lightly with your hand. Circles work really well. One way, then the other way. There's no magic speed. There's no magic depth. It's because tissue moves everywhere. I usually say start with about 10 seconds to 20 seconds. Easy. I don't care which side you start on as long as you do both. Then you do the other collarbone above and below. This to me is the most important place in the body to work every day. I work that spot no matter what hurts on you. If you come in with a hangnail, I'm working your collarbone first, and I'm not kidding. That's number one. Number two is the largest lymph node in the neck, and it sits on the side of the neck, way up high, right behind the angle of your jaw and below the lobe of your ear. So if you put your fingers up there, you'll find a space behind the angle of your jaw. And if you're doing it now, you may feel it's tender, puffy, or swollen. That's extremely important. That one drains the tongue and the oral cavity and brain. The vagus nerve passes right by it. So if you're locked here, you're going to have a vagus nerve problem, which means you're going to have an inability to control stress. Number three is at the shoulder, pec, armpit. This is called your axillary region, pectoral. This is the one where women who have breast cancer, this is a big one because it gets congested a ton. So that's the one where I have people rub along the pectoral muscle and go underneath it, kind of where the armpit is. And I even have them grab that pec muscle and massage it a little bit, almost like you're just kind of massaging like a pizza pie dough. Like just get in there and ease it up a little bit. Then you do the same thing on the other side. That's spot number three. Spot number four is the abdomen, the navel and above. So this is the one where I have people put both hands on the belly and you just start to rub. You press in light on the skin and do circles one way, other way. You go up and down sideways. Then I want you to start pressing in a little bit deeper, just giving yourself a nice, comfortable abdominal massage. You don't have to go very deep to make a big difference in here. And in Eastern medicine, they'll tell you if you massage your abdomen 20 minutes a day, you'll change your life. And I agree with that. So spend some time in the abdomen. Then number four is the crease of the groin, where when you sit, your pant leg creases. Those are called your inguinal lymph nodes. And those sit right across all the blood flow and nerves to your legs. So there you massage right around the crease of the groin, the whole thing. Rubbing in there, you can even do little taps on the body. That's like a Qigong technique they teach in Eastern medicine. So you rub the groin on both sides. Spot number six, the last spot, is behind the knees. So you place your hands behind the knees, you go up behind it, above it, and below it. Rub there, slap there, tap there. They call that the magic back point in Eastern medicine. I think it's part of your bladder meridian because it really helps ease tension in the lower back. But that's a big block point for swelling and inflammation and poor blood flow in the foot. So that's the big six. You do the big six, then you can dry brush everything else. You do the big six, then you walk. Do the big six, then you jump up and down. Lymph always travels with nerves and blood flow. So if I free up those regions, nerves feel better, blood flow goes better as well, because nerves are gonna tell you they're not happy by sending you pain when they can't get oxygen. And they ain't getting oxygen if you have poor blood flow and poor lymph flow, because the nerve starts to die. And when nerves start to die, they scream louder, which means tingling and numbness and pain.